Hi, so now I'm going to show you how to enter data once a patient's just had an operation. So the first thing is you're going to have to find the patient. Now, they might be in the active patients section already shown, but if you are operating on a patient who's not in your feed, then you might need to search for them in the search box. And you can either type in their name or you can type in their NHI number, for example. In this case, Olive Asher has just had an operation. Now, usually it would be the registrar who does this at the end of the operation, along with some of the other paperwork. In our institution, we kind of divide that paperwork up, and the registrar will do the DIVA record and the pathology, and I will do the operation note. So once you click on it, you actually get shown previous admissions as well on the left-hand side. And it will usually select the most recent admission, which is what you're going to be using. On the middle section here, it shows the data, and as you can see, there's not much data there at the moment. So we need to create an intervention for this patient who's just come off the table. So we'll click on Interventions, and then it opens up a new intervention form for you to fill in. This patient's just had an operative intervention. It started at 0800, it finished at 0900. It was under Sid Ingram, general speciality. The ASA was 2. The timing was urgent. Operation category was minor. The wound category was possibly contaminated, anesthetic type general. Unplanned reintervention. So we would use this if this wasn't the index procedure and say a person was returning to theatre for a complication. So in this case it was an index procedure. We will click no. Further intervention is for later use. If the patient goes back to theatre, then this will be edited to show yes, but for now it's no because there is no further intervention. And now we've reached the end of this form. We want to create a procedure. So an operation may have several procedures. That's why we created it like this. So the first procedure that this person had was to do with their skin, and they just had a wound closed basically. So I can't find anything under skin, so I'm just going to type in a different search and put wound, and there we go, skin wound closure. So I select that. And then here, the text, you can change it to be a bit more descriptive. So I say lack on back. And that just helps with future looking at the records. The approach was open. The operator was Sid Ingram. There were no assistants. And there was another procedure, so I'm going to click yes for that. And the other procedure for this patient was that they actually had a melanoma on the back as well, so we took the opportunity to take that off as well. So here we'll put in here back melanoma. We'll fill in the rest of the information. As you can see now, this has already been pre-populated because of the previous procedure. So we're done now entering in the procedures. We clicked no, and then now it wants us to put in some diagnosis. So the first diagnosis was the laceration. And here we have a skin laceration, and we'll put that on the back. And it says here make final diagnosis. So at the moment it's a pre-op diagnosis, and we know that some diagnoses change after an operation. This patient's had an operation, we're pretty sure they've had a laceration, so I'm going to click yes. And now it asks for a few more details. Variance means was it different to normal? I'll click no. Recurrence means was this a recurrent pathology? It wasn't. And for discussion means, is this something interesting that we want to discuss at the M&M meeting? It may not necessarily be a complication, but it's maybe a rare diagnosis. But for this case, it's no. Then, do we want to make another diagnosis? Well, yes, because there is a melanoma. So we're going to put in melanoma. Oh. There we go, skin melanoma. And this one here, we can't make it final diagnosis yet because we don't have the pathology back. and that would give us the T&M stage. So we're going to leave it as a pre-op diagnosis. So I'm going to click no there. And then that is the data entry done for a patient who's just come off the table. Next I will show you the next data entry point, which is usually at the point of discharge.